Once being employed, the treatment I was receiving in North Carolina, I did not um, think that they were going to help me in regards to getting all the access to the medication, access to medical care, access to a primary care physician, being unemployed too as well. Um, I also need assistance in getting my houses stable and finding new employment. And being in North Carolina, that was not an option for me. They had access to things like that, but not for the, I guess, the number of people that's coming forth with their diagnosis. To my perspective of it, they wasn't seeing it to where everything was a dire need for me. Um, I did speak to several people there and saw that I couldn't get access Medicaid. I had to access community-based organizations who had a great caseloads. Um, you had to go to the clinics. You was, on a served by a first come first served basis. So it was a lot of um, hurdles I had to cross in North Carolina. A lot of things that I understand. I even heard someone say to me one time that we have Ron White funding. So all you kept hearing was Ron White funding. But Ron White funding, after you found out, was the burial of last resort. So what happens before you got to the burial of last resort? By then, you really just don't have anything. So in thinking I'm going home anyway, I'm going to DC, thinking I was going to run into the same obstacles, same hurdles, and got here, and it was a lot different. It was a lot easier for me to access service, access Medicaid, access primary care physician. It was a great deal of, and don't get me wrong, DC had its challenges just as well as North Carolina did, but not as bad. It was a lot more easier for me.